Poverty and poor health form a vicious circle, encircling within it hundreds of millions of people in India and rest of the world. Among the many causes of this complex problem, let us take a look at two. According to the WHO, 649 million Indians lack access to essential medicines. This is 65% of India's total population and 38% of world's population without access to essential medicines. This despite the fact that India, known as Global Pharmacy of the South, exports low-cost drugs worth $10 billion annually to over 200 countries. Meanwhile, industry estimates suggest that drugs worth about $600 million or 5% of India's domestic market size of $12 billion go waste due to expiration. Another contributing factor to poor health is that India spends only about 1% of its GDP on public health care. As a result, India ranks 171 out of 175 countries in public health care spending. Despite low budget, policy decisions are ineffective. Sample surveys of hundreds of people are used to frame policy decisions affecting millions of people. An example of this can be observed by taking a look at the statistics of tuberculosis program implementation in India. Government spent $300 million annually on tuberculosis treatment, but about 350,000 people die annually due to tuberculosis. The reasons are a combination of lack of medicines being available to people despite being provided for free by the government, and poor outreach to tuberculosis eradication policies. This is a result of insufficient data available with policymakers. Meds4All strives to solve these social problems with a two-pronged strategy by working with a network of partner NGOs throughout India. Phase 1 will be about increasing low-cost access to essential medicines by collecting demand of medicines for BOP consumers from our partner NGOs working in healthcare domain using an online platform, and work with pharma companies to get medicines about to expire in next 3 to 6 months at up to 60% discount. On Phase 2, we will strive to improve efficiency of policymaking by driving actionable insights from multiple NGOs' data which is collected using a mobile application digitally, and work with state and central governments to increase efficiency of policymaking. Our social impact can be measured by the number of people helped and amount of money saved for BOP consumers, and also by the number of people affected due to increased efficiency of policymaking. Do not forget the environmental side as well that can be seen by the wastage and the pollution we are preventing. Meds4All will have two sources of revenue. Phase 1 will involve focus on Meds4All.org as an online platform for selling the medicines to BOP consumers via NGOs. The revenue stream from this source will be a margin on the transaction through our platform, with all our profits invested back in our enterprise. Phase 2 will involve working with a mobile data collection tool for NGOs to collect data. Using collected data from multiple NGOs, we will drive actionable insights. This data will be shared with central and state governments who will use it to improve efficiency of policymaking. We have two partner NGOs, Aadhaar Parivar and Earth Saver Foundation, already associated with us, who have shared the list of medicines and the kind of data they can collect. We are also receiving very good responses from top pharma companies. For more information, visit our website www.meds4all.org or email us at contact@meds4all.org.